Global science runs on a simple, foundational assumption: trust. When a researcher publishes a medical trial or an engineering study, the community assumes the data was rigorously gathered and objectively peer-reviewed. But in global academic publishing, a massive shadow economy has taken root. Roughly 27% of all predatory journal publishers worldwide are based in India, and an estimated 35% of authors in these compromised journals are affiliated with Indian institutions. This is a highly organized, industrialized system of academic fraud. Clandestine commercial entities, known as paper mills, churn out fabricated, plagiarized, or heavily manipulated research and sell the authorship slots to desperate academics. By flooding academic databases with fake data, these paper mills are actively poisoning the core literature that doctors, engineers, and policymakers around the world rely on to make life or death decisions. The root cause of this crisis traces directly back to policy mandates issued by regulatory bodies like the University Grants Commission. They introduced systems that tied career advancement, faculty promotions, and even the awarding of PhDs directly to raw publication volume. Research became a bureaucratic checklist. This chart maps out the impossible math. To secure promotions, medical faculty must produce roughly 50,000 eligible publications over a 7-year period. But legitimate domestic medical journals only have space for 8,500 papers, leaving a catastrophic shortfall of over 41,000. Thousands of inexperienced researchers and young PhD candidates find themselves forced into a corner. Their careers hang in the balance, and their institutions rarely offer any actual guidance on how to write or submit legitimate manuscripts. When bureaucratic mandates demand high-volume output, but the legitimate supply of publication slots is mathematically capped, the market invariably provides an illicit alternative. The front line of this shadow economy does not operate in obscure dark web forums. The brokers who facilitate these illicit transactions openly solicit researchers on common messaging apps like WhatsApp and Telegram. Local intermediaries act as a bridge between struggling academics and ghostwriters. Companies like the Chennai-based Itrelon curate massive community group chats, treating scientific authorship slots as fast-moving consumer goods and hawking ready-made papers with guaranteed publication. This tiered price sheet illustrates the exact cost of academic prestige in this black market. Brokers openly auction off stolen or fabricated manuscripts, charging roughly $165 for a first author position, with the price scaling down for secondary authors. Once a broker secures a buyer, the fake science is laundered into the public domain by predatory publishers. Using a model pioneered by the infamous Omics Group, these publishers discard peer review and editorial oversight entirely. They exploit the legitimate open access science movement by charging exorbitant article processing charges. Authors get their low-quality papers accepted in days, and the publisher collects the fee, operating a pure pay-and-publish revenue machine devoid of scientific rigor. As the scale of this fraud drew international embarrassment, the government tried to intervene by establishing static, vetted whitelists of quality journals for hiring committees to reference. The paper mills immediately adapted. Tech operators began executing cloned journal scams. If a legitimate, obscure journal from Turkey or Germany made the government whitelist, fraudsters would commit digital identity theft, buying a nearly identical domain name to trick Indian researchers into paying fees to the fake site. To bypass automated plagiarism detectors, the mills rely heavily on translation software and basic AI to automatically spin existing published texts, swapping out technical words with synonyms. This automated evasion births absurd linguistic anomalies, known in the scientific community as tortured phrases. Standard medical terms are butchered by the software. Breast cancer, for example, gets rewritten as bosom malignancy. Static bureaucratic whitelists cannot contain a dynamic, tech-enabled black market. The fraudsters constantly iterate their evasion tactics, faster than the hiring committees can track them. Fabricated research leaking out of academia carries severe external costs. In the healthcare sector, doctors use purchased clinical trials to secure promotions to hospital leadership roles. Unethical physicians end up dictating medical protocols and training the next generation of staff. In the alternative medicine sector, heavily promoted under the Ministry of Ayush, frequently utilizes these predatory journals to bypass rigorous randomized control trials and falsely validate their products. By publishing sham trials in dubious journals, pharmaceutical entities falsely claim their drugs are peer-reviewed. Unproven and occasionally hepatotoxic, drugs hit the mass market shielded by a veneer of junk science. The technology sector faces the exact same quota pressures. Universities mandate massive patent filings to boost their institutional rankings, resulting in a flood of junk patents, meaningless modifications filed solely for the metrics rather than actual innovation. This metric obsession culminated during a recent AI summit in New Delhi. A university proudly unveiled a quadruped robot, presenting it to national leaders as a marvel of indigenous Indian engineering. It was swiftly exposed as a commercially available, off-the-shelf Chinese consumer toy. The global pipeline of progress is actively absorbing this damage. Modern large language models train on vast scrapes of scientific databases. By injecting thousands of fake, tortured phrase papers into the corpus, paper mills are currently data poisoning the global AI development pipeline. Dismantling this ecosystem requires a structural teardown of the incentives that fuel it. Regulators must abolish raw publish or perish quotas. Career survival must be decoupled from sheer volume, shifting instead to a qualitative system where promotion committees read and evaluate a candidate's 2 best papers. Institutions need to weaponize technology against the fraudsters, deploying AI-driven image forensics to catch manipulated biomedical data and automated screeners to flag tortured phrases before manuscripts are ever reviewed. Finally, academic fraud must carry severe, legally binding consequences. India requires a central regulatory body with the statutory power of a federal trade commission, one equipped to investigate, prosecute, and financially destroy the empires built by predatory publishers and local brokers. Until the academic system stops commodifying discovery and realigns its incentives toward rigorous integrity, this factory of falsehoods will continue to thrive. A nation's scientific output will only ever be as accurate as the metrics that reward it.